I'm the sleep program coordinator here at the SNOR Center with Dr. Sharkandi. Sleep program coordinator involves coordinating appointments with my sleep patients. I do all of the consultations, initial consultations. I set patients up on their baseline sleep studies. I review sleep tests with Dr. Sharkandi and the patients. We discuss matrix testing, oral appliance therapy, mostly education and follow-ups. I essentially run the sleep program here with him. So it's a lot of work, but it's rewarding work. Everyone needs to see their dentist for general purposes, cleanings, fillings, etc. Sleep is, I find, much more dynamic in the sense that if you're suffering from sleep problems, and there's over 80 different types of sleep disorders out there, but even suffering with one sleep disorder, can interrupt your entire quality of life. So if I can just be that one piece of the puzzle that can help someone get a better quality of sleep, then for me, that's what's rewarding about this job. My experience with Matrix Plus testing it's been a really positive one. Prior to using this technology, we had to, inform our patients that potentially the treatment we were about to provide may or may not work, which is never overly reassuring for our patients. Since getting the Matrix Plus technology here in our practice, I can now, with confidence, say to our patients, if we do this testing, we know with 98% accuracy if this treatment is going to work for you, if you will be a responder to oral appliance therapy, which is very exciting because now our patients are much more excited about going into treatment with us, given that we can provide them with that kind of information. There's another member of our team who is considering switching from general dentistry into more of the sleep apnea side of things. After watching me with my patients and seeing how rewarding it can be to successfully treat our patients with oral appliance therapy and, now with the combination of Matrix Plus testing, she's seen how much fun it can be and how rewarding it is when patients feel better about their quality of sleep and, come in talking about how refreshed they are. They're not snoring and bothering their spouses anymore. So it can be very, very rewarding on that sense. I would give the advice that, it's a lot of work dealing with the sleep program, but it's the most rewarding work that I've ever done in a dental practice. There really is nothing else like having a patient sit in your chair who's been suffering for 20 plus years, 30 years with sleep disorders. Once they've been successfully treated, I've had patients cry in my chair. I've had patients look at me and thank me. I've had patients give me hugs and just tell me how much it meant to be successfully treated with another therapy aside from CPAP. Because I can only imagine how frustrating it would be to have someone, try surgical options, CPAP therapy, medications, sleep hygiene, and nothing works, and then they come see us, and using Matrix Plus technologies and oral appliance therapy, we've successfully treated them and their whole quality of life has changed. And that's what is the most rewarding thing about this program for myself.